Hello everyone, welcome to week 1. So in each of our weekly videos, I will go over the chapters that we're covering this week and some main topics to make sure you focus on as you're doing your reading. I will also cover our assignments and materials and give you any important information to make sure you pay attention to for the week. This is my dog, Naya. I apologize if you hear her participating in any of our lectures. So our week 1 chapters are divided into 2 PowerPoints. 1A and 1B is what you should see in your Noodle or Moodle platform. So the first PowerPoint covers chapters 1 through 4 as well as chapter 6. So we'll start off with week 1. Chapter 1 is a great way to dive into start developing your understanding of what pharmacology is and what pathopharmacology is. We also introduce what the nurse's role is in administering drugs and taking responsibility for assessing any drug effects and documentation as well as teaching. It is important that you are familiar with the safety categories for pregnancy drugs. So you should know the difference between A, B, C, D, and X. And those will continue to come up throughout this course. There won't be any history questions on the Controlled Substances Act, but it's important for your practice that you're very familiar with it and what your job is, especially because it can vary by state. In chapter 1, we also just make sure that terms like generic drugs, orphan drugs, over-the-counter drugs are all defined. It may be helpful for you to make some flashcards or to start making a study guide during chapter 1 to make sure terminology regarding the pharmacodynamics is familiar to you and you're able to pick out those terms if asked. When considering absorption, distribution, biotransformation, and excretion of a drug, it will be important to know about your patient and how your patient condition may alter these properties. So being very familiar with these terms and what they mean will be important for any medication we cover in this course. Also looking at half-life, this is something that you may be asked to calculate on your board exam. It is something that comes up frequently with drugs, so make sure you pay attention on slide 28. There is a nice visual of what half-life is, as well as a description. And then on 29, there are some practice questions that come right out from your textbook, box 2.2, that help you practice looking at what a half-life would be. It's not very confusing, but it's very important that you're able to calculate a half-life. As we move through the chapters and we talk about adverse effects, it's important that you know the difference between primary actions and secondary actions of a drug, as well as the difference between a hypersensitivity and an allergy. So pay attention to that slide and make sure you're comfortable talking about the differences between those descriptions. It's also important to think about toxicity, most specifically liver injury and renal injury. As you'll learn, those are the most common areas of toxicity with drug administrations. You'll find that the slides for week 1 have a lot more bold terms and words that you should become familiar with. I expect that most of you have seen them at some point during your life, but it's important that as we're going through the course, you're familiar what hypoglycemia versus hyperglycemia means, as well as knowing the definitions of electrolyte imbalances. So take some time to review those if they're not familiar. If they are, then just make sure that what your understanding is matches our definition within the textbook. In the week 1B PowerPoint, we cover chapters 15 through 18. So it starts off with the introduction to the immune response and inflammation, looking at the body's natural defenses and natural barrier systems. I think these will come easily to you. It's important to become familiar with the types of white blood cells that are produced in the body, and you should be aware of where they come from. On the 8th slide, there is a nice visual of the inflammatory response. I encourage you to take time looking at it and looking what occurs with tissue injury in your body, but I would never ask you to fill in this chart or to identify something that's missing within one of the independent steps. So take time looking at it, making sure that you understand it. Mostly you understand where your swelling, redness, and heat are coming from, and that they do cause pain as part of their inflammatory response. But do not become overwhelmed or spend too much time trying to memorize the flow of the inflammatory response. It's good to know what a histamine release is and where it acts and how it is a little bit different. So take time reading about that. You should know the difference between the functions of your T cells, so make sure that you can compare an effector versus a helper versus a suppressor T cell, and there's a great slide on 18 giving the differences between those. Going into chapter 16, we look at the anti-inflammatory, anti-arthritis, and related agents. I will expect that you know the common anti-inflammatories, but do not spend too much time looking into a lot of the medications that you've never heard of. As always in this course, it's important to know the class of the medication and the characteristics within that class, but you do not need to memorize a bunch of drug names. So within the inflammatory response, it's important to know the different types of drugs that can work in the anti-inflammatories and how they're different. It's important for you to know drugs like aspirin and acetaminophen, but do not spend too much time memorizing the others. Because acetaminophen is used across all age groups and is one of the most commonly misused medications by people at home, it's very important that you understand the actions, where it acts, and how it impacts the thermoregulatory cells, and the things that where it's metabolized, where it's excreted. So pay a lot of attention to acetaminophen. For the treatment of arthritis, it's important that you're familiar with the tumor necrosis factor blockers. These are often the first line of medications used with progressing arthritis. So make sure that you know the pharmacokinetics and the patient teaching that comes along with that. In chapter 17, we move on to immune modulators. These include both the stimulants and the suppressants that modify the actions of the immune system. So immune stimulants energize the immune system when it needs help fighting a specific pathogen, and immune suppressants block the normal effects of the immune system. This is specific for organ transplantation and autoimmune disorders. So spend some time especially doing patient teaching and nursing considerations while looking in this chapter, especially for patients that are on immunotherapy drugs. There is a very specific field, so we won't dive too deep into it, because if you go into this type of nursing, you'll have a lot of extra training. But it is important that you're safe and that you know what the terms mean and specific thoughts that you should have for a patient receiving one of those therapies. Finally, we move into chapter 18, which talks about vaccines. It is important that you know about the different types of immunity and how they are passed, as well as the definition of immunization and the goal. This is a common misperception within the community, so it's important that nurses have a strong understanding of what immunization is and what the goal of it is. I will not ask you to memorize the childhood vaccine schedule. You may be asked to do that in your pediatric course, but it will not be included in this course. What is important is that you know the specific vaccines that would not be appropriate for patients of certain ages or patients in certain settings, including being in the hospital. So you should, for safety, make sure that you know if a provider asked you to give a vaccine to a certain patient, which vaccines should ring a bell in your head that you really need to question that order, and if it is the appropriate vaccine for the appropriate patient in the appropriate setting. So as you're going through these chapters over week 1, I strongly encourage you to try a variety of different methods to figure out what works for you. For some people, it may include printing out the PowerPoints, putting perhaps 6 or 8 slides per page, taking notes as they're reading through the chapters, and then listening to my description at the end. For other students, it may be most beneficial to use the highlighting and note-taking that is available in your ebook in CoursePoint. I encourage you to be open to a variety of methods of learning. This is likely the most condensed course that you've taken and will cover the most amount of material that you have covered in a college or nursing course. So the most important thing, I think, is to be proactive and to really consider your expectation for the course and how you're going to fill the 20 to 30 hours per week, being most productive, and also setting yourself up so you have time and you're prepared for your midterm, and then subsequently so you're prepared for your final. I am always here to be a reference if you are feeling overwhelmed or if you would like any guidance. My recommendation would be to use the PowerPoint slides, however is most helpful for you. I know that for some more tech-savvy students, it may be most beneficial to create a study guide that way. However you study, I strongly encourage you to go over into the Prep U option in CoursePoint and tackle some of the practice questions that come with your chapters, because that's the best way to regularly quiz yourself and to become familiar with the way that this textbook writes their questions, because these are the questions that will be used in your quizzes and in your exams. I wish you the best of luck, and I am excited to work with you this semester.